Module C, Responding to a Potential Concussion. This module presents information on how to respond to a potential concussion-causing event. The CAT concussion pathway is a visual representation of the appropriate response and management of a suspected concussion. When a potential concussion has been recognized, the next step is to respond appropriately. Each situation will be unique, but the response includes basic first aid to assess for serious injury and the need for immediate emergency medical care. Serious injuries, such as a spinal injury or a fractured skull, should be ruled out before continuing. This is followed by an assessment for red flags. If the situation is determined to be a medical emergency, call for an ambulance and stay with the person until emergency services arrive. Do not move the person, and if applicable, do not remove their helmet unless trained to do so. Once an emergency situation has been ruled out, the person should be removed from their current activity and assessed for the signs and symptoms of concussion. The effects of a head injury do not always follow a predictable pattern, so someone with a suspected concussion should not be left alone and should not be allowed to leave on their own. An emergency contact should be informed as soon as possible to arrange for transportation and monitoring over several hours for deterioration or red flag symptoms. If the event occurs at work, follow the workplace incident protocol as appropriate. This may include documenting the event, seeking medical assessment, and mentioning to your healthcare provider that the incident occurred at work, communicating with the workplace, and following up with your relevant workers' compensation board in your province or jurisdiction. The emergency contact or someone else might need to follow up with the workplace to request more information, recognizing that a person with a concussion will experience difficulty navigating these steps. The CAT Concussion Incident Report for Adults is a tool that can be used to document the details of a suspected concussion event. It can be provided to the emergency contact and should be brought to any medical appointments. If signs and symptoms are not present, the person with a suspected concussion can resume normal daily activities, limiting strenuous activity for the first 48 hours. Continue to monitor for delayed signs and symptoms of concussion for up to 48 hours. This includes looking for visual cues and listening to what the person says. If no signs or symptoms are present at the end of the 48-hour period, the person can resume normal activity. If signs and symptoms of concussion appear during this period, the person should stop their current activity and seek medical care. Most concussions can be managed without a visit to the emergency department. However, early assessment by a licensed medical professional or healthcare professional with relevant training has been associated with better recovery. This assessment can rule out more serious forms of injury or other medical conditions and confirm a concussion diagnosis based upon patient history, physical examination, and additional tests as needed. The CAT resource, Questions to Ask Your Doctor, may help guide and record the discussion about concussion management and recovery. Although there is a movement to standardize concussion recognition and management, not all medical or healthcare professionals are aware of the current best practices and guidelines. You might want to seek a second opinion if the licensed medical or healthcare professional is unable to comprehensively assess for concussion, including balance and cognition, dismissive of your symptoms, or if the advice contradicts current concussion management strategies, such as advising total rest. A medical assessment letter should be requested to document whether a concussion has been diagnosed or not. This may be particularly important if the concussion did not occur at work and may help facilitate the return to work process. A standardized medical assessment letter for concussion is available in the resources section. A concussion assessment should include a medical assessment, including the identification of any signs and symptoms of concussion, education about the need for physical and cognitive rest, and a conversation about developing a return to work or a return to activity plan. Continue to the quiz to test your knowledge on responding to a potential concussion-causing event.